Hi, I'm Tiffany Helberg. I'm here with Dr. St. Anthony Amofa, our Chief Medical Officer at Community Health of South Florida. We're here to talk about the Omicron variant for this COVID virus. Dr. Amofa, what should people know?
Okay, thank you, Ms. Helberg. So there are quite a lot of things that are unknown, but there are a few more that are unknown. One is that we know that it was first identified in South Africa, and it is known that it's already spread to several other countries. Now, let's be clear. The fact that it was identified in South Africa does not mean that that's where it came from. It's a fact that scientists state out there. And so there are about 4 or 5 other countries that are also detecting this virus, suggesting that it's already spreading across the world. It has not been detected in this country yet, but statistically, it's highly suggestive that it would have done already. Okay, so it's important to know that it's out there, it's possibly in the US already. But one other thing that we must know, and is clear on this virus now, is that it's able to spread very quickly. Okay, so this Omicron variant is a copy of the original COVID virus that allows it to spread more quickly. A concern is that it's made so many different types of itself, okay, that it will make the immune system difficult to identify it and fight it when you get infected with it. So while we don't know at this point whether it will cause more deadly illness, we do know that you're more likely to infect other people when you get that. In fact, more than 10 times some of the previous variants. So that's what people need to know.
So if people have gotten their vaccines and their booster shots, are they protected from this?
So the data suggests now that there is some protection. So in South Africa and Israel, where they have been looking at this more closely, they do see that folks who are getting who are getting exposed to this virus, when they get sick, it tends to be milder. But again, these are just a few cases they've seen that in, and so we're not sure about that yet. But definitely, there's a perception that the virus provides more protection. The vaccine provides more protection against this virus, but more will be coming out over the next few weeks.
So what's your guidance for people as they head into the holidays? Can they gather with their families? Should they travel or not?
So I think that the guidance we've been getting from CDC are really paramount now. First of all, we have to get vaccinated. The more of us get vaccinated, the better the chances that we won't transmit the infection. But the social distancing, the masking, the disinfections of hands are crucial. I think the kind of position is folks still would want to spend time with family, but we should not let our guard down, right? Just assume that, as always, anybody you come in contact with could have this virus, especially if they've had exposures elsewhere. Travel is certainly a concern. There are travel bans already beginning across the world from today and some from last week. So I think it's more of where you can travel to and where you should not travel to. And the CDC and the country will be providing some of that detailed guidance. I'd encourage everyone to look out for it because it's all about risks. The countries that are seeing a lot more of this virus are places where you don't want to travel to.
Okay, Dr. St. Anthony Amofa, not a time to let our guard down. Thank you for that information. And here at CHI, we do offer the vaccine as well as COVID testing. So check us out online. You can make an appointment or call us, chisouthfl.org, or call 786-272-2100.